us now is Dr. Robert Murphy, a professor of infectious diseases at Northwestern University Feinberg School of Medicine. Good morning.
Good morning.
Does it seem strange that restrictions are being lifted across the country, and why are several states still in orange?
Well, because this is guidance. People can do what they want. Companies can do what they want. States can do what they want. Cities can do what they want. But the guidance is you're vaccinated, fully vaccinated. You do not have to wear a mask indoors or outdoors in any situation other than the ones that Robin just mentioned.
But then it's also, the city is also confusing people because they still want businesses to keep their mask protocols in place. It's still very confusing to people.
Well, you know, I think it's human nature in that when you, after a whole 15 months of this, people have been wearing masks. They've been told, wear a mask, wear a mask, wear a mask. And literally, all of a sudden, on last Thursday at 1 p.m., oh, by the way, you're fully vaccinated, you don't have to wear a mask. It's caught people just, I think, psychologically off guard. If you look at the scientific data, you don't need a mask indoors or outdoors if you're fully vaccinated.
What does this mean for Lollapalooza? Do you think it's a good idea? I mean, they're supposed to have proof of vaccination, but we've talked about how that's kind of tenuous.
I know both of you guys are planning on going, so please tell me.
I'm fully vaccinated, so I can go. anyway, no, the Lollapalooza says you're going to have to show vaccine proof or that you had a negative test. And I bet you anything that they're going to have rapid testing there. But it's a huge event like that is a gamble. But again, if you're vaccinated, it should be okay.
Illinois schools might require in-person learning, but no vaccine mandate to go along with it.
Yeah, okay, we mandate all sorts of vaccines for kids. I mean, this is a given. However, there's, for kids, it's only approved for kids down to 12 years of age. So under 12, there are no vaccines available. Those studies are not going to be done now for many months. So we have to wait for those to get finished. As far as middle school and high school with the 12 and up, I'm not sure all of them can actually get vaccinated by the fall. Plus, I think a mandate is going to require full FDA approval. And they do not, nobody has full FDA approval yet. Pfizer has applied. I think Moderna has also applied, but that's for adults. Yeah, the Pfizer is for down to 16. So I think we're going to wait for full approval before any mandates going anywhere.
All right, and next question. Even though COVID-19 deaths are significantly down, are those still dying not able to get the vaccine, not willing to take the vaccine, or is there some other reason Illinois and other states continue to see COVID deaths?
This is a great question. Our metric in the death department has not budged. Everything else has improved. All those numbers you put up every morning, the number of cases, the positivity rate, all that stuff is improving, hospitalizations, everything. Why is the death rate stuck here in the low 20s approximately? California, which is more than 3 times bigger than Illinois, only had 3 deaths yesterday. What is going on here? When I saw that question earlier this morning, 6 a.m., I actually shot off some emails to some people in the state and city and some epidemiologists I know that are looking at this data to try to get a handle on it, because I think it's a great question. I don't understand, but they've got data, and so I've asked them. So we'll see.
All right, we'll check back in on that. Another question, Dr. Murphy said there's no blood test to see whether the vaccine worked or not, but there is a way to test for a body's natural immune response from an infection. This implies that the vaccine and the body's defense against COVID-19 is different. If true, how can he explain how they differ?
Yeah, this is another good technical question. The commercial tests that are available today, if you go into your doctor's office and ask for an antibody test for COVID, you're going to get an approved commercial test by one of the big test makers like Roche or somebody like that. And what those antibodies have been developed for are people that already had COVID. It has nothing to do with the vaccine. And it's just a very simple antibody test. It doesn't predict whether you're protected from getting COVID again. It's not good enough, all right? It's great, to tell you if you had COVID, but it is not good enough to tell you you had immune protection. You go into our immunology lab at any my university or any of the major schools that are studying this, yeah, we can find out whether your immunity is good enough. But those are not commercial tests. They're very complicated tests. They take a long time. You can't even sell those tests because they're not approved. They're not standardized between places. So for all practical purposes, there is no test we can just order. It's much more difficult at this particular time.
Gotcha. If you have a question for the doctor, you can post it on our Morning News Facebook page. We'll talk to him again tomorrow at this time. And Larry will email you about those Lollapalooza tickets, okay?
Oh, I'll get in line for the Flock of Seagulls stage.
I need a bonus.
Hey, Paul.